Welcome to today's webinar series entitled Getting Reimbursed, Updates on Billing and Documentation for Health Behavior Assessment and Intervention Services in 2020. Our presenters today are Dr. Stephen Gillespie, APA's Senior Director of Healthcare Financing, and Ms. Megan Duganhaus, APA's Coding and Payment Policy Officer. This webinar series has been pre-recorded and broken down into segments to make it easier for you to understand and refer back to. Our objectives are to understand the H&B code set review and revision process, to introduce the 2020 Health Behavior Assessment and Intervention Services, and we'll review the new CPT codes, descriptions, and coding structure, as well as provide an explanation of how the existing codes crosswalk to the new codes. We'll also apply the new codes using clinical examples and review coding guidelines, payment policies, and reimbursement values. In this section, Dr. Gillespie and Ms. Duganhaus will expand on a health behavior assessment clinical example.
So to review, what we have on the screen is our base code structure. As we talked in our previous webinar, there are three components to the typical base code. On the left, you have the pre-service work, which we typically think of as the non-face-to-face services. So those are the activities you perform prior to seeing the patient. So that would be reviewing records, gaining additional information. Next, you have the intra-service work. This is considered the face-to-face work with the patient. And this is going to be the bulk of your intervention and the time spent within the code set. And then you have the post-service work, which again are non-face-to-face services. This would include information, sharing your note with others, providing feedback to other healthcare providers. And again, for the health behavior assessment intervention codes, this is very important because these codes will involve you interacting with other healthcare providers and working in multidisciplinary teams. So here is our first example. This is our example of the health behavior assessment. Here we have a 65-year-old male with osteoarthritis, chronic back pain, and medication-related sleep difficulties. He's referred for a health behavior assessment to determine the psychological factors requiring intervention as part of the patient's overall treatment plan. So a couple things that are important to remember for the health behavior assessment case. One of the most important things to remember is that for that intra-service time, you have three required components. Those three required components are the health-focused clinical interview, behavioral observations, and clinical decision-making. Again, the clinical decision-making, that's going to involve integration of your assessment results, developing what the treatment plan should look like. Again, that's the cognitive piece where you're integrating all that information, developing your treatment plan, case conceptualization. A couple other things that are important to note about the health behavior assessment, and again, just review from our previous webinar. Remember, the codes used to be both an assessment and a reassessment codes. Those were timed codes in 15-minute increments. Our new code for this example, the health behavior assessment, they've been collapsed into one code, and it's an untimed code. It's an untimed code very similar to the diagnostic interview. So even though if we think about our code structure, we have pre and post service within this, it's just like the diagnostic interview. So again, it's an untimed code.
So here we have an example of a claim form that's been completed for the assessment service. And as you can see, we've only reported one unit of CPT code 96156, and that is because this service is now an untimed service and is reported very similar to the way that CPT code 90791 is reported for psychiatric diagnostic evaluation.
In this next section, our presenters will share with you some resources for the 2020 Health Behavior Assessment and Intervention Code family.
Throughout this webinar series, we have reviewed all of the new CPT codes, the code descriptors, the RVU values, as well as the crosswalks for reporting the new HBAI services beginning on January 1, 2020. For your convenience, all of this information has been compiled into their own individual resources and are found on the reimbursement section of the APA website. That website is above the first link reported. We strongly encourage you to go and visit this site, download these resources, and begin familiarizing yourself as well as your staff with the new codes so that you're fully prepared to implement the new code set come January 1.
In addition to the current resources that we have available, we will be producing additional publications, new information and resources to assist you and your staff with making the transition and implementing the new HBAI codes that will go into effect in January. So specifically, one resource that is under development and will be coming your way in the near future, we are developing a health behavior assessment intervention billing and coding guide. This will be similar to the guide that was developed for the psychological testing and neuropsychological testing services. So we're in the midst of developing that, and we'll get that out and available. That will be available to not only members, but we'll also make that available to payers as well. Additionally, after the webinar and as questions start to come in, we will do, we'll have frequently asked questions and we'll respond to that, as well as additional resources will be forthcoming.
Thank you for viewing our webinar series on the new HBAI family of codes. And thank you to our presenters for sharing this important information to help us all prepare for 2020. APA Services, Inc. is available to help members with any health insurance or managed care issues, whether this involves private or government insurers. For issues related to billing codes and Medicare, or any questions regarding the content of this webinar series, please contact the Office of Healthcare Finance at ohcf@apa.org. For issues with Medicaid or private insurers, please contact the Office of Legal and Regulatory Affairs at praclegal@apa.org. If you are unsure of who to direct your questions to, you can also reach out to the Office of Healthcare Finance, and they will help direct you to the right person. Thank you, and have a great day.